This morning's health segment is sponsored by Mountain Grown Folgers Coffee. Folgers, the best part of waking up.
22 minutes before the hour, Dr. Bob Arnott's been ranging far and wide this week to get you the best advice for conquering back pain. And this morning, Bob is with us from Fairfield, Ohio, just outside Cincinnati. Morning, Bob.
Good morning, Harry. So far this week, we've looked at some pretty high-tech options for the treatment of back pain. But what do real people do in the heartland when they have back pain? Well, they go to the chiropractor.
I can't live without my chiropractor.
Chiropractic treatments are by far the most popular alternative for those suffering from back pain.
Let her relax, stretch.
After doctors and dentists, chiropractors have become the third largest group of health professionals in the country. Worried about safety? Even this pregnant woman doesn't give chiropractic treatment a second thought for her back pain.
Have you had much in the way of leg pain?
No.
Okay.
But it's only recently that chiropractors have enjoyed this kind of respect. For years, medical doctors looked at them as second-class citizens, even quacks. Until a 1990 court ruling found the American Medical Association guilty of conspiracy to restrain trade, the AMA boycotted chiropractors. Since that ruling, there's been a substantial thaw in the relationship between doctors and chiropractors.
I love it when you do my neck.
Okay.
The biggest surprise, studies reported by the American College of Physicians and the RAND Corporation show what patients have known for decades. Chiropractic treatment works for bad backs, especially if the pain is acute and caused by muscle strain.
Prior to chiropractic care, I was sort of on the road to possible surgery. I was in a back brace. It's through him I really think that I got the quality of life that I have.
And the headache and all that stress, when I'm sitting out there in the waiting room going like this, just everything's tight. And when he adjusts that, it just lines it all up and the pain is gone.
I was just in a total spasm. And of course the doctor kept asking me these questions and I felt like saying, stop asking questions, just work on me. I was in so much pain, my body was shaking. And a half hour later, all the pain was gone. I bowled Friday night and I played tennis Monday morning, and I'm fine.
Chiropractic treatment is distinctly low-tech, high-touch. And to help us understand it this morning, we have Dr. Robert Poteete. Nice to see you. Now, will you run through what you would do, say, for someone's back like mine in terms of trying to make a diagnosis after your history and physical?
Well, the chiropractor, like any other doctor, will rely on consultation and history and thorough examination. But the chiropractor is particularly skilled at assessing the spinal function and movement through a hands-on assessment.
Right, and Harry, I've got a sore back. I'm not saying where it is, but we'll find out.
What I'd like to do is cross the arms up there,
right.
And we can actually run through some range of motion here, feeling the movement of the back and the different segments in the back. For instance, in through here we have a lot of restriction and tightness. Let's rotate through. We have 6 ranges of motion. We'll try to test them all. Okay, we find some restriction right through this area in the back in this region, the LD spine. And what we would do once we find an area of dysfunction or lack of movement is the adjustment or the manipulation.
And what Harry, let me say that that's exactly where I'm tight, right through here, through a little bit too much rollerblading.
Rollerblading. What we attempt to do with the adjustment or manipulation is restore function or movement.
And how fast can you do that? Is it a matter of a day or a week or?
Depends on the chronicity of the problem, how long the problem's been there. If we're just overcoming muscular tightness and restriction, ligamentous tightness, or actual bony with degenerative changes in the spine, it's different for different patients. You want to rest your head for just a second there? Deep breath in. And just add a little bit, and we can force a little bit of movement through those joints right through there. Feel that tightness.
Now, the key question so many people have is safety. How does someone who's not used to going to the chiropractor make certain that it's a safe thing to do?
Well, you know, when we consider the outcome studies that have been done, patient response, cost-effective studies, and particularly safety studies, the chiropractic treatment is a particularly safe treatment and should be considered a first-line approach in the treatment of low back care.
Thank you very much, Dr. Robert. Dr. Harry, back to you.
All right, thanks very much, Bob. We'll be right back.
For a video cassette recording of this week's series on bad backs, conquering back pain, call 1-800-542-5621. The price is $23.45. That includes shipping and handling. The number again, 1-800-542-5621.
17 minutes before the hour, Michelle Lee's just ahead on CBS This Morning. Stick around.